This is Headline Humboldt. I'm James Faulk. Thanks for joining us. When we left 2020 behind, many of us expected fate would downshift. Surely there wouldn't be 2 straight years of catastrophe. Our collective problems wouldn't necessarily disappear, we told ourselves, but momentum would shift. We'd gain perspective, and a clear path forward would emerge. But that's the thing about fate, right? It couldn't care less about the plans we make or our expectations and pretensions about a life that makes sense. Since the turn of the year, things have only gotten worse. National political divisions are bordering on violence. The nation is stuttering through the rollout of our long-awaited vaccines, and all the pent-up enthusiasm unleashed at year's end caused the worst infection numbers so far. But if you look carefully, there have been glimmers of hope, possibilities that, if responsibly nurtured, could usher in the end of this bleak era and facilitate a return to normalcy. The state's numbers, for instance, are finally trending downward after the holiday surges, and the systems for vaccine delivery are improving even as other vaccines queue up to come online. But in Humboldt County this week, we've suffered through some of the highest infection numbers to date, a surge that state models are predicting could cause us to run low on ICU beds in the next several weeks. It, like everything else, is a situation that county health officials are closely monitoring, as you'll see in tonight's show. At the same time, they're working to improve the delivery of vaccines across the county, and in particular to the freshly allowed recipients specified under Tier 1B, like teachers, child care providers, and agricultural workers. One helpful step to grease the medical wheels: the county has developed a form on their website, humboldtgov.org, where people can put their names on a list for a future vaccination appointment. If you don't have a primary care provider or are confused about how to move ahead, fill out that interest form, and when your slot comes up, county officials will schedule you an appointment. 1 step forward, 2 steps back. 2 steps forward, sidle to the side, put your left foot in, shake it all about. This has easily been the most complicated and difficult logistical challenge in modern times. And all these conundrums only underline how important it is to stay informed, follow all the distancing and masking rules, and be flexible when your appointment finally arrives. Now, the interview. Recently sworn in Eureka City Councilman Scott Bauer joins us tonight to talk about his election, his priorities, and how he thinks he can make a difference in shaping Eureka's future. Welcome, Scott. Can you hear me?
Yeah, thank you for having me.
No problem. I'm glad that you could make it in on relatively short notice. So you're on the city council. That's exciting. How was your campaign, and what do you think you learned about your electorate, your constituents during the process of running for office?
You know, obviously it was an unusual campaign season. I went door to door and practiced safe distancing, and so that was one of the things that was really interesting. Was people weren't afraid. They were willing to engage, at a distance. But the really interesting part and a big learning thing for me was people are engaged in this town. I can't tell you how many doors I went to where people said, I went to your website. I've been studying up on the candidates, and I think you don't see that nationally, this kind of engagement, but the majority of people knew the issues, knew the candidates, and there were 5 of us. So I thought that was the most fun part about the whole campaign, was going and talking to people and having so many people care about a city, know the issues, and wanted to make an informed decision. And that was a super fun part and enlightening part of the whole campaign process.
I think that probably makes it a little bit more challenging for the council members and for politicians, because there's probably more accountability there. Were you collecting a list of issues that seemed to be predominant when you were running, and if so, what were they?
What's one of the main issues that affects, I think, all towns as a function of lack of revenue? Roads. Our roads are a mess, people want to see, and not just roads. It's transportation, right? It's roads, it's wanting to have trails, it's,
infrastructure,
being able to get around, safely,
yeah,
and, efficiently. And that was pretty much number one. And maybe that seems kind of trite, but people want that. They want that service. And as you know, as most of us probably know, needle exchange, homelessness. I mean, pretty much those top three were universal amongst people. But real quick, I will say that one of the other things that was really a nice thing to see is people appreciated where Eureka is. They like Eureka. They love Eureka. Mm-hmm. They wanted to continue to move forward, and I thought that was really nice. That people felt like, yeah, we have our issues, but we think it's going in a positive direction, and that was really something I hadn't thought.
Yeah, those are interesting observations. As we're all sort of observing the political division that we're seeing nationally and statewide and everything else, people really apparently are focused on sort of the bread and butter concerns for city government. And I think that that's actually edifying and probably reassuring. I mean, I think that the divisions can be overcome maybe if we just focus on doing the things that we're actually supposed to be doing in city government and elsewhere. You mentioned the needle exchange and also homelessness. Those are two huge issues that have been affecting Humboldt County. You recently voted against allowing, I think, the Hatcher's mobile needle exchange program to be permitted during the course of the COVID pandemic. Why? I mean, I'm just want to explain that vote for people.
I think in a situation like this, which is a serious situation, we're talking, a medical device that can be dangerous. And I relate a story about my son when he was, 2 years old, almost sticking a friend's child with a needle they found on the ground, So, I think when it comes to an issue like this in a operation like this, it requires trust. It requires, professionalism for not only to build trust between the organization and the council, but to build trust with the community. Mm-hmm. And so some of the things that occurred in the process of us coming to, trying to reach an agreement, I thought were unprofessional. The county operates a needle exchange. I thought, it was keeping things going. I just thought, it's an issue that requires us to all be professional. We all realize it is a health issue. Never doubt that. But I was disappointed in some of the things that were said, some of the editorializing in the operations plan. Mm-hmm. Therefore, I thought maybe we should wait until we actually have an ordinance in place.
Basically, the Hatcher, you believe, was critical of the city and the proposal that it put forward. Is that right?
Correct.
Yeah. So, I mean, basically, that sort of links in with homelessness generally. I've been in Humboldt County a long time, since I was a little kid, and there's been this process where we have something that's nice for tourists, something that people have spent a lot of money on investing to make attractive, and there's a homeless problem. So at first it started in Old Town with remove the benches, as if by removing the benches you'll remove the people who were laying on the benches, and that's not really what happened. They just moved around. People built the boardwalk, and then the boardwalk becomes a magnet for people who are homeless. Understandably so. It's a nice place to be, and if you don't have a place to be, why not hang out there? It seems like there's a lot of dancing around the actual issue of finding these people's homes. What do you think about the long-term prospects for addressing homelessness in Eureka, and what do you think can be done?
Well, I think it's important for us all to understand. I mean, it's a nationwide problem. There's millions of homeless people. We are not alone in this situation. People are vocal about it on both sides. I heard all spectrum of how to deal with it, with the situation, but it's a national tragedy that we have so many homeless people. And you go to Oakland and look underneath the freeway there, and it's heartbreaking. I don't think it's an issue that will ever, I mean, locally, we'll do our best. You know, we've got affordable housing projects coming online with the Link project. Betty Chin does the best she can, but it's something bigger. Yeah. And, we're going to deal with it in the city by trying to address housing. There's opportunities there, but I see it as the need for more cohesiveness with the county, at the state level, help from the state, help from the federal government. And it really comes down to a segment of society that's just been marginalized, the kind of deindustrialization of America. It's a systemic problem that, it can't be solved overnight. And so we try and build affordable housing. We try and find places for people to go, long-term housing, but it requires more than just our little city to deal with. So I'm hopeful that we can achieve some gains through housing, but we need to really partner with the larger community, Humboldt County, the state, if we're going to have a long-term, a long-term impact. And I think, not to go too long on this, but I could go on this subject forever.
No,
because,
that's important. This is huge.
You see, just as when I was a kid, there was one homeless guy, and this is Southern California, that we knew. That was it, and here we are, for me, 40 years later, and there's homeless people everywhere. Yeah. And it's not by a choice, so I see that really having worked together to try and fix this problem. And really it's about, jobs and this, and it comes from addiction, and there's so many issues that it's a daunting task.
Yeah, a lot of issues come together. I mean, economic and mental health and addiction and all those things, unfortunately, are in confluence with the homeless issue. So you're on the council now, and it seems like when I was covering the council in my years at the Times Standard and since, that there was a real left and right battle for the council. There was not to typecast or anything, but there was like the Rob Arkley, Virginia Bass sort of contingent, and then there was a more leftist Peter LaValle kind of party that was battling with them to sort of get control of the city government. Now it seems like things have centered center left, that there is a kind of a cohesion in terms of the political philosophies on the council. Do you think that you are yourself a part of that wing? And I wonder if there's something lost when there isn't a sort of conservative voice speaking more towards being careful with city money and taxes and that sort of thing.
Yeah, I don't like. I think people want to label us or label certain, provide a label and say you're progressive or you're whatever, and I don't consider myself. I consider myself progressive, but at the same time, I believe in having an adequate police force. I believe in things that maybe seem conservative, and when you talk to the community, there's all spectrum of people, and it's important that we listen to all political shades of gray, because I'll say this is an interesting talking to people around the city, really conservative folk, when we'd have a long conversation, they will tell you that they believe in needle exchange, that it should be a 1-for-1. And that to me was just the most enlightening thing, that, that's how far we've come. I mean, we may differ on what we think about national politics, but locally, whether you're conservative or liberal, people have similar thoughts and care the same about their community. So I think the city's going in a great direction. Mm-hmm. I think where we are and politically, I don't want to put a label on me, or have anybody label me, but I think we're going in a good direction. And I think if we listen to all of our constituents, you'll see that we all have similar interests, and similar cares. We want Eureka to be a great place to live, a safe place to live.
Hey, Scott, I hate to cut you off, but we're out of time. Sure. I got to have you back on the show because this was a really great conversation, and we barely scratched the surface, I feel like. So maybe we can do this again soon?
Absolutely.
All right.
I enjoyed it.
All right. Thanks for your time, and have a great weekend.
You too. Thank you.
We'll be right back after this short break.
China is not the producer of this epidemic.
Frontline investigates the beginning of the pandemic.
He had identified the virus and that it was not highly transmissible. I think he was just wrong.
It seemed absolutely ridiculous that we couldn't release the data.
The missed opportunities.
That was the shot we had, and we lost it.
And how China responded.
They haven't admitted anything. They haven't admitted any kind of mistakes.
Year after year, PBS has been bringing you the news you trust.
We care about the things that are going to affect the lives of each and every American.
The in-depth analysis you need.
What we normally see in these big crises.
And the true stories that have to be told.
We're a place that people can come not just to find out what happened, but why it matters.
It's all thanks to the support of viewers like you. Thank you. And stay tuned to America's most trusted network.
Humboldt County Public Health Officer Ian Hoffman is tasked with guiding our community through this pandemic as safely as possible. In statements to the media this week, Hoffman described the complexities of vaccine distribution when there is limited supply. Giving the vaccine to one person means keeping it away from someone else, he said.
We have to balance a lot of priorities, and there's really, it's a zero-sum situation at this point, because when you give a vaccine to one person, you're taking it away from another person. Very difficult decisions. We're weighing risk of disease with societal function and getting us back to a normal existence. We're following the state guidance, the phases and tiers, and we're moving through it and going forward as quickly as the vaccine supply allows.
With people all over the country describing the difficulties in getting a vaccination appointment, Hoffman said the county has been proactive in simplifying the process. There's a sign-up sheet online.
We created an interest form on Humboldt Health Alert that can be filled out to give your information that you want to receive the vaccine. And we are using that information to invite people who don't have access through their primary care providers, create clinics for them. That can be used by anyone, but certainly if you're in an age group that is open right now, go on, and you haven't been invited by your provider, go on the website and fill that out. If you cannot fill it out yourself, if you don't have a family member or a friend or a neighbor who could fill it out for you, you can always call the Joint Information Center at 441-5000, and they can help you fill that out over the phone.
While state COVID numbers are trending downward, Humboldt County's infection rate this past week has been higher than at any other point in the pandemic. Some state predictions have indicated that this could result in a shortage of ICU beds.
I don't think we have any indication that our ICUs are going to be full in the coming week or two, but I do think there is a concern that there have been more hospitalizations for COVID-19 in the past really week than we've had at any point in the pandemic. So we're going to continue to monitor that. I've been in contact with the state about that trend here locally, and if we see anything else that needs to be done locally, we'll definitely start to have that discussion.
State Senator Mike McGuire this week hosted a town hall meeting to address both the good and the bad in the state's COVID response thus far. He minced no words in kicking off the event. The state and federal governments have to do better, he said, because people's lives are at stake.
2020, to say the least, was challenging. We must pick up the pace with the distribution and execution of the vaccinations. And I want to be honest with you tonight and provide some straight talk. I think that we can all agree that the vaccine rollout has not been smooth, both on the federal and at the state level. And you deserve better. The problems that we've seen at the federal and state levels, the lack of supply, the lack of a concrete distribution plan, the confusing eligibility requirements, not only is it disappointing, it's incredibly frustrating and it's unacceptable. And I assure you, you have my commitment, and you're going to hear this tonight. I assure you all levels of government are working overtime to be able to expand distribution, to expand the ability to get shots into arms, and to streamline the process of the vaccine.
Dr. Timothy Brewer from the UCLA School of Medicine spoke to the progress that's been made in recent weeks in turning back the post-holiday surge that inundated hospitals up and down the state.
We have turned that surge around. To put that in perspective, between Christmas and the middle of January, we were averaging about 40,000 new cases of COVID-19 a day. That's now down to an average of about 25,000 a day. And today they reported just over 17,000 cases. Now, I know there's a lot of concern about variants, and we've been hearing about the UK variant and Brazil variant and South Africa variant. Coronaviruses change as they spread. That's true of almost all viruses, especially RNA viruses. So that's natural. Most of the changes we don't worry about at all, but sometimes those changes can make the virus spread more quickly or be a little more deadly. So far, no real good evidence to suggest that any of the changes has affected how deadly this particular virus is, but there are some data to suggest at least the UK variant and the South Africa variant do spread more easily than what was present before. So far, the vaccines seem to work against these two variants as well.
Lori Nezhura, Deputy Director from the California Office of Emergency Services, precisely described how the state was failing in its COVID response and what needs to change.
The vaccination story in California is a story of the good, the bad, and the ugly. So let's dive right in on some of the good. The healthcare system and the public health system has worked heroically to administer almost 2.6 million vaccine doses in the 7 weeks since we've received our first doses. Yes, it was slow to begin with. We needed to do a better job of providing clearer information to the public. With 61 local health jurisdictions, and that's 58 counties plus 3 cities which have their own health departments, plus additional multi-county health systems like your Sutters and Kaisers and whatnot, all using different operational systems. It's been very confusing for Californians to sign up for appointments and find out the availability of vaccine. It's also with the eligibility guidance rolling out piecemeal and sometimes changing midstream. It's no wonder folks have had confusion about what is the eligibility criteria.
After the January 6th riot at the Capitol, North Coast Congressman Jared Hoffman and Representative Jackie Speier have introduced a new bill to make sure that their fellow members of Congress can't bring guns to work. The No Congressional Gun Loophole Act would remove members of Congress and their staff from an exemption for firearms on Capitol grounds. Current Capitol Police Board regulations allow such firearms, and the issue has been hotly debated in recent weeks. Some Democratic members of Congress have expressed concern that their radicalized Republican counterparts may present a threat. The bill would require members of Congress to comply with District of Columbia gun safety and registration requirements. Quote, "I've been pushing for years to change this outdated rule, knowing there was an inevitable risk in allowing members to carry guns in the Capitol," Hoffman said. "While we'd like to think we could rely on common decency, we now have colleagues who are QAnon and white supremacist sympathizers, incite violence and insurrection, and have even bragged about bringing guns into the House chamber. You can't have an honor system with dishonorable people who think the rules don't apply to them." Speier is a survivor of gun violence. As a staffer for then Congressman Leo Ryan, Speier was involved in a fact-finding mission surrounding Jim Jones's People's Temple in Guyana. They were ambushed as they prepared to leave. 5 people died, including Congressman Ryan. If the bill ultimately passes through the House of Representatives, it would move on to the Senate for consideration. Eureka Mayor Susan Seaman this week urged people to be prepared in case of an emergency. She had reason. Regional power outages this week impacted thousands as a strong storm pummeled the North Coast.
It is a beautiful day to be here on the boardwalk following a pretty blustery storm this past week. And although we heard reports of thousands who lost power, the outages were fairly short-lived in Eureka. It was an important reminder that winter is here and we're not immune to power outages, falling trees, and icy temperatures. It's not too late and never too early to practice some good emergency prep for the next big storm. Stock up on flashlights and make sure your batteries work and you have backups. Keep your phones and extra battery packs charged, and make sure your house is stocked with several days of non-perishable food and water. If you need electricity for medical reasons, make a power outage plan for medical devices and refrigerated medicines. Install carbon monoxide detectors with battery backups at every level of your home. Don't use a gas stove or oven for heating. Don't cook with camp stoves in the house or outdoors near windows that are open. And always make sure your generators are outside. Turn off or disconnect appliances, equipment, or electronics to avoid damage from momentary surges or spikes in the power returns. And of course, check on your neighbors to make sure they're okay. Older adults and young children are especially vulnerable to extreme temperatures. If you're caught out on the road, remember to drive safely. Make sure your windshield wipers don't need to be replaced. And remember that if your wipers are on, your lights should be too.
She's talking about preparing for emergencies or preparing for the average Thursday in the age of 2020 and 2021. That's all the time we have for tonight. So far, 2,754 Humboldt County residents have tested positive for the virus. Today alone, 3 additional deaths were reported. There have been 2,416 recoveries, 101 hospitalizations. Stay tuned, stay informed.